What can we do within our health IT organizations to prepare people for what's coming next? And is that our responsibility as CIOs of the organization? And if it is our responsibility, what are we going to do? David, I'll start with you.
Well, by the way, I do think that training is actually a reward for the people in IT. It's an incredible motivator. And so professional development seems to be a way to attract and retain people. So couldn't agree more that doing that is important. And it's important for selfish reasons, the ones I mentioned. If you want to keep people, what I used to tell people that worked for me, and I found it very effective, and by the way, I meant it, is that every year that you stay at this organization, I will find a way to make sure that you get some kind of professional development. And next year, your resume will be so good that you wouldn't leave, because the year after that it'll be that much better. And the idea is I want to make you prepared for the next job, but I want that next job to be inside my organization. And so it's not enough to change just the staff. You have to change the environment in which you're working. And that's where you need to be looking for innovations and how you can use technologies that people haven't thought about. And you have to move people's skills along. And it is true that there are a few people, a few percentage points of people who just don't want to change. They want to keep doing the same things with the same skills that they want. But in general, I find that the vast, overwhelming majority of people want to be trained. They want to be challenged. They want you to ask them to get smarter next year than they are this year. I think having those kind of people around you makes you better. And the idea is the smarter they get, the smarter you need to be. And so as a CIO, I've always felt pushed because they would always bring topics that I wasn't familiar with to me. And I felt like that old joke, you don't need to outrun the bear, you just need to outrun your friend or your companion in this case. And so the idea is I find that I probably get about 100 emails from listservs every day. And people go, that's ridiculous. And it's like, it may be ridiculous, but it helps me look for trends. It also helps me look for what's new that I wouldn't have anticipated had the staff not brought it to me or brought it to me. And so I think those are interesting things to pay attention to.
So one of the things that I would say about staffing is there's a huge difference in the staffing challenges and probably strategies in markets that we've all been in, right? I was in the Boston market for many years. You, Bill, were in the LA, Southern California market. David, Dallas market. You've been working with a client in the New York market. Very, very, very different in terms of competition, being able to draw people. When an Epic implementation is done at one major system in the area, that you can get some of them onto yours if you're not that far, and they don't have to move houses and change kids' schools. They're ready for the next one, right? But how many healthcare organizations and IT shops are not in those big markets, who are just in the very same need for talent? And how do they find that talent, and how do they retain that talent, and how do they grow that talent? I'm in a market like that right now. It's beautiful. I love seeing the mountains every day in Burlington, Vermont, but it's a little far away and a little bit harder to recruit for. So those are really different staffing challenges that you have to look at. But when it comes down to it, the culture of your organization, your commitment to your people, you're investing both time and money in training them and preparing them for the future. Some of that is the same, but you have to recognize that you've got some different challenges.